Welcome to this presentation for the Bacteriology course. We will talk about Pseudomonas aeruginosa as a treatment for candidemia. We are QFZ students at the Faculty of Chemistry at UNAM.
Pseudomonas aeruginosa is a gram-negative aerobic bacilli measuring from 0.5 to 0.8 micrometers by 1.5 to 3.0 micrometers. It has a flagellum for motility. It is both catalase and oxidase positive. The different species are distinguished by biochemical and DNA hybridization tests. It is characterized due to the production of diverse pigments such as pyocyanin, pyoverdine, and pyorubin. Pseudomonas aeruginosa may cause various diseases, and they mainly occur in healthcare settings. This bacteria may be resistant to different antibiotics, making it difficult to treat. Localized infections following surgery or burns commonly results in a generalized and frequently fatal bacteremia. It also may cause urinary tract infections as well as endocarditis following cardiac surgery or meningitis. Pseudomonas aeruginosa has different virulence factors that we can group in three main categories. The first one is bacterial surface structures, the second one is secreted factors, and the third one is bacterial cell-to-cell interactions. The first group, bacterial surface structures, contains surface appendages like the flagella, outer membrane components like lipopolysaccharides, and secretion systems. The second group, secreted factors, is conformed by exopolysaccharides, siderophores like pyoverdine and pyoclin, protease like elastase A and B and protease 4, and toxins like exotoxin A, exolysine, lipase A, and pyocyanin. The third category, bacterial cell-to-cell interactions, includes quorum sensing as well as biofilm.
5-methylphenosine 1,1 or pyogenin is a metabolite belonging to the group of phenosines, which designates those heterocyclic nitrogenous compounds with functions as diverse as antibiotics or as DNA intercalating agents. This gives them a high level of physiological importance. During its reduced state, pyogenin may react with free oxygen present in the lungs, affecting various cellular functions. This is due to the formation of reactive oxygen species. Causes cellular dysfunction in the respiratory tract, causing pro-inflammatory and oxidative effects that damage cells by disrupting catalase and mitochondrial electron carrier chain, playing a protective effect against reactive oxygen species and nitrogen species produced by cells of the immune system. Pyogenin also has the ability to disrupt calcium homeostasis and induce neutrophil apoptosis. All this combined favors the invasion of tissues, promotes the establishment of disease, and consequently contributes to the virulence.
It has been reported that this disease arises from the genetic mutation in the transmembrane conductance regulator (CFTR), whose function is to mediate the transport of the chlorine ion. The bacteria's pyocyanin has been found to affect patients with cystic fibrosis. Pseudomonas aeruginosa is very often detected in the sputum of patients with this condition. The bacteria generates epithelial dysfunction due to pyocyanin that interferes with ciliary beads, since cilia are needed to sweep mucus in the throat. In addition, it causes neutrophil apoptosis, the release of immunoglobulins from B lymphocytes, and release of interleukin 8, which causes the lungs' immune system to weaken.
In the United States, there are 25,000 cases of candidemia per year, increasing the mortality factor to 40%, coupled to the fact that patients who have candidemia have their immune systems weakened, either by surgery, a condition such as HIV or cancer. 95% of candidemias are caused by C. albicans, C. glabrata, C. tropicalis, and C. crusei, that they are resistant to the first and second line of antifungals, fluconazole and echinocandria, in the third or quarter of isolated strains. A decrease in mortality has been observed if the antifungal treatment begins early, going from 50% on day 1 of detection, 24% on day 2. You can see the relationship in the graph to the left. If there was a delay of 72 hours from the blood culture, mortality increased from 27 to 40%. In the case of candidemia by sea average, it was observed that the initial treatment with echinocandins had a reduced mortality compared to the pollines, such as amib desoxycholate, but nephrotoxicity and variable sensitivity were observed against this strain, to the appearance of fungal resistance for a new mutation mechanism in the steryl methyltransferase gene ERG6. Blood cultures are very helpful, but they take time, which is why to begin to use 1,3-beta-D-glucan or BDG, which has a sensitivity and specificity of 82%, which allows at the beginning or interruption of treatment in case of negative results. We want to use piocyanin in the treatment for candidemia. The objective is to use the mechanism of action of piocyanin to limit the damage of candidemia, drop the oxidative stress that it would cause to the strain of candida that is in the bloodstream. We will do this by extracting piocyanin and carrying out studies to define a therapeutic dose that helps against the candidemia and avoiding harm to the patient as much as possible. So, antifungals are more effective, avoiding kidney and liver damage due to their use.
Superoxide dismutase catalyzes the dismutation of superoxide into oxygen and nitrogen peroxide. Because of this, it's an important antioxidant defense in most cells exposed to oxygen. This causes more free oxygen and when is used by piocyanin prevents cellular damage. Piocyanin also affects other pathogens that depend on antioxidant enzymes like catalase to defend against oxidative stress. By generating reactive oxygen species, it produces a toxic environment that overloads the antioxidant system of cells. When a catalase-dependent pathogen comes into contact with piocyanin, its catalase needs to handle the free radicals of its own metabolism and deal with the additional wave of reactive oxygen species generated by piocyanin. This can decrease its effectiveness and weaken the pathogen's antioxidant defenses. Pseudomonas resistance to this oxidizing environment gives it an advantage, while other microorganisms are left unharmed.
In patients with cystic fibrosis, concentrations above 100 micromolar of piocyanin have been documented. However, to cause apoptosis, it has been reported that piocyanin is concentration and time dependent, with a 5 hours exposure to a concentration of 50 micromolar being sufficient. It has been shown that around 95% of Pseudomonas aeruginosa strains produce piocyanin. Piocyanin plays an important role in iron metabolism, as it is abundantly produced in media with low iron content. It is also known that the enzymes named PHCM and PHCS of Pseudomonas aeruginosa are those that collaborate in the synthesis of piocyanin from phenazine 1-carboxylic acid, as we can see at the reaction. Cetrimide agar can be used as a medium for the selective isolation of Pseudomonas aeruginosa and other species of the genus. Its formulation allows for the stimulation of pigment formation. Magnesium chloride and potassium sulfate promote the formation of piocyanin, pyoverdine, pyomelanin, and fluorescein. Colony growth can be differentiated by pigments. The presence of a blue-green color corresponds to the production of piocyanin, which is the pigment we are looking for, while a green color corresponds to the production of pyoverdine, and a light pink, reddish, or dark brown color corresponds to the production of pyorubin.
We have to start with the extraction of piocyanin with the following steps. First of all, we prepare cetramide agar and 0.5 McFarlane standard equivalent with a fresh culture of Pseudomonas aeruginosa. 3. Set the cetramide agar place by spreading in 3 different directions. 4. To get the best performance, getting piocyanin will incubate at 35 Celsius degrees for 72 hours. Using the sterile distilled water, bacteria are washed from the surface of the agar plates. 6. The agar was cut aseptically into 1 cm squares and placed in the sterile bottle. 7. 20 ml of dry chloroform was added and filtered using number 1 filter paper. 8. Repeat to extract remaining pigment. 9. A 10 ml of 0.2 molar of chlorhydric acid was added to the chloroform solution, and after shaking, the red pigment was passed to the aqueous phase, leaving the lemon yellow chloroform phase. 10. A volume of 10 milliliters of dry chloroform was added to the aqueous phase and shaken until the blue pigment passed to the fluorophore phase. 11. The chloroform phase was removed and filtered. 12. Dry petroleum ether was added drop by drop until the blue crystals of piocyanin are formed, 3 milliliters of ether for each 1 milliliter of chloroform. 13. The blue crystals were removed.
To verify the functionality of the method, two clinical analysis routes are promoted. The first route is based on performing a fungal culture test to deliver a sample of cells or fluid from the part of the body where Candida may be growing. Because Candida can infect different parts of the body, different samples can be taken. Skin and nail scraping are the first. We're going to scrape the surface of the nail or take a biopsy of the skin surface. Second, swab sample. We use mainly for infections in the mouth, vagina, or an open wound. Third, urine sample. We use for infections in genitourinary organs. Fourth, sputum sample. This is a mucus sample from the lungs and it is used for upper respiratory tract infections. The second route is to take a sample of the patient's blood. In this blood test, a study of antibodies for Candida is done in serum, as IgA, IgG, and IgM, mainly used for systemic and vaginal candidiasis. Eventually, the patient will show signs of improvement and samples incubated on agar without growth referred to Candida.
For the toxicity test of biocyanin, the proposed method is a cytotoxicity assay in vitro using cell-tox green DNA as fluorescent DNA binding dye which penetrates dead cells. The protocol is the following. Add cell-tox green DNA binding dye until a dilution of 1 to 500 in the culture medium. Then mix the tube containing the suspension of cells to ensure dye homogeneity prior to seeding into assay plates. After that, seed the cell suspension in opaque wall assay plates. Then add biocyanin at different concentrations as well as the vehicle controls for a final concentration of dye of 1 to 1000 dilution. Finally, measure fluorescence intensity. After that, we expect to obtain a graphic like this one where we can see the fluorescence which is directly proportional to the dead cells in contrast to the exposure period in hours at different concentrations.
Thank you for watching. Auf Wiedersehen.